welcome back to Face It with Dr. G. I'm Dr. G, and we're back here for another episode of something amazing. And if you guys haven't heard, we are launching our Patreon March 1st, and we're so excited for you to check it out, potentially subscribe. If you like listening here, you'll only get more in-depth information. This is specifically for injectors and business owners of aesthetic practices. I don't think that somebody would pay for that if they're not in the field, but maybe. But I'm so excited for that and excited for you guys to let me know what you think. So today we're going to talk about my top 3 mistakes that I see when injecting neurotoxin. And this is what I believe happens when you have someone who injects Botox or Dysport and the patients just have a fine result. They're like, yep, I'm happy, it's fine. How do we get that result from good to amazing? And these are the mistakes or maybe pitfalls I see with that approach, and how I want to give you my tools on how you can amplify your treatments and make those results even better. So the first mistake that I think people make is reconstitution. So we're trained to reconstitute our neurotoxins with a certain amount of bacteriostatic normal saline. And I get it, math is hard. I don't like to do math either every day. And we get into a routine. So we don't think outside of the box when it comes to more or less saline. We don't think outside of the box when it comes to how strong is the muscle that we're injecting. And we don't think outside of the box when it comes to what is the actual muscle that is causing these lines. Because I think there is sometimes a misconception about what the actual muscle is that is doing the majority of the work. For example, when we talk about the glabellar region in the forehead, we have the glabella, it's the area. We have the procerus, and then we have the corrugators. The procerus muscle actually is a depressor. It pulls down, and so it causes the transverse line on the nose. Not everyone has that line, okay? The corrugators pull in, and so they are the muscles that actually cause the 11s. The 11s are not caused by the procerus. However, for some reason, people still decide to inject the procerus in every patient. That's usually not the best way. So in patients that have a transverse crease at the base of the procerus, inject the procerus. But for those patients that only have the 11 lines, maybe try thinking outside the box and inject the corrugators only and see how your result is. You likely will find that patients don't feel that angry bird appearance anymore, pulling down with the procerus because you haven't injected it, and they'll have a lighter, more open result. If patients want a medial lift to their eyebrow, just inject the corrugators. Don't inject the procerus. So that's a little bit of a couple points on how I think you can amplify your results. There are more ways to do this when it comes to the forehead and the frontalis muscle, for example, by using a slightly weaker dose in the lateral frontalis where the muscle is thinner versus in the center where the muscle is a little bit thicker. The second mistake I think people make, and their barrier to having incredible results, is the depth of injection. And this relies on a deep understanding of anatomy and the depth of these muscles. Also the thickness of muscles. So for example, when we have an injection that we want to place in the masseter to decrease clenching, this is a deep injection. I likely will inject deep on bone. You don't necessarily want to go superficial. There is a superficial belly of the masseter that you can inject. You just need to be very careful, because if you grab the risorius muscle, you're going to affect the patient's smile. Another example is the lower face. So the lower face, the depth is extremely crucial to understand. You have muscles on muscles, and the 3 muscles that are the most important in the lower face, actually I'll mention 4, the mentalis, you have the DAOs, the DLIs, and you have the platysma. So when I inject the lower face, I like to inject all of those areas. However, you have to be very careful, and the DAO lies right on top of the DLI. And as we all know, if you are familiar with injecting, if you inject the depressor labii inferioris, you're going to have an asymmetric smile with a weakening of that side of the lip. It does not pull out, so your mouth is asymmetric, and your affected side, your lip is going to be closer to your teeth or more elevated. All right. So there it's important for depth. I would also mention in the frontalis and the forehead, Depth is important because there are more nerve endings that we've seen and identified that are deeper. So there's a belief that if you inject deeper on bone in the frontalis, specifically centrally, your result's going to last longer. Okay, so those are three of my little tips and why depth is important. And the third mistake that I would say is that you're misidentifying the lines from animation and the lines from muscle movement with lines that are superficial, skin health related, and can be improved with important and effective skincare. And I would like to say that this is mostly around the eyes. And you have movement around your eyes that is a combination of the orbicularis oculi muscle as well as the zygomaticus major and the movement of that cheek upward, up and laterally, superolaterally. So you are not going to affect the lines that are caused by movement from the smile and the cheek and that volume moving up. You will be able to affect and relax the muscle that affects the lines around the eyes, that's specifically the orbicularis oculi muscle. So it's important to understand that concept, and also another thing to understand is what lines are caused by sleeping habits. So you have sleep lines that will form clinically in a different way than dynamic lines, and understanding those is important because they obviously want your patient to be happy. And if they come back and say this injection didn't work for me, it's likely because you either didn't inject a muscle or you injected an area where that muscle wasn't the reason for those lines, if that makes sense. And you can also check out my podcast that specifically discusses sleep lines versus dynamic lines, and that's a really fun one. But I think at the end of the day, understanding your patient, understanding what they want, with every patient I'll ask, what do you want? Do you want movement? Do you want to be frozen? These aren't things that you need to just make up and assume about your patients. Listen to them and then talk to them, and obviously have the questions handy that will help make your decision easier for you. So I hope that helped. Give me all of the love, share this with your friends, family, colleagues, and I'll see you again next time.